Partnerships and Outreach Working Group webinar series. We welcome our guests from within the consortium, from within the DSI consortium and outside. This webinar is open to the public. And this is, the title of this webinar is Engaging Policymakers in Health Research. And we have two esteemed speakers with us today, Dr. Frank Njenga and Kison Ndlovu. So I will just read the bio of and introduce Dr. Njenga. So Dr. Frank Njenga graduated as a doctor from the University of Nairobi in 1975. He subsequently obtained the membership of the Royal College of Psychiatrists in 1980. After training at Maudsley Hospital in London, he was later elected Fellow of the Royal College. He taught at the University of Nairobi before venturing into full-time private practice in 1983 through the media, public lectures, as well as talks to professional bodies in school. He was, for a long time, the public face of mental health in Kenya. Over the years, he has led the campaign against stigma and mental health, using, among other methods, the mass media. His TV series, Frankly Speaking, broke the silence over mental health issues and led Kenyans to embrace the message that mental illness is common and treatable. He is the author of several books, including a textbook, Psychiatry, numerous scientific publications, as well as long-running weekly column in the Business Daily. His latest book, Healing the Mind, published in 2022, is a compilation of articles published over the last 15 years addressing common mental health issues, including family and pregnancy challenges. He's also the founder and chairman of Chiromo Hospital Group. Most recently, he was the chairman of the National Task Force on Mental Health and subsequently was the presidential advisor on mental health in Kenya. So please help me welcome Dr. Njenga, and we look forward to his insights, knowledge, and experience. So thank you so much for joining us, and please go ahead.
All right, you're good to go?
Yes, we're good to go.
Right, okay. You've been told my name is Frank Njenga, speaking to you from Nairobi, Kenya. I have a brief presentation to make this afternoon. The first slide that I will be presenting is essentially a description of what it is that I have been asked to do, which is how, the question I was asked to address is how to engage with and influence African policymakers and government officials with the specific aim of helping to ensure that research products lead to better health outcomes. And I'd like you to keep in mind this particular requirement of this presentation, and I'll keep coming back to it from time to time. The first question perhaps that comes to your mind is, how do I qualify to address such a heavy subject? Well, you've been told I've been a psychiatrist for over 40 years. I'm an old man. I am an elder in my society. And in Africa, the position of being an elder comes with its own privileges and problems. I have had the privilege of engaging with mental health services at a global level with the World Psychiatric Association. I have been able to engage with psychiatrists on the continent as the African Association of Psychiatrists, and as well as at the national level. What I'm saying is very important because, as you will see, one's engagement with policymakers requires that you appear on the scene with policy makers having seen you in action previously. I come back to my own country, Kenya, once again. One of my earliest engagements goes back at least a quarter of a century when I worked with our President Moy following the bomb blast at the American Embassy in Nairobi. We then got another president, Kibaki, who asked me to work with him at the national campaign against drug abuse, which I chaired for about 8 years. The immediate past president, Uhuru Kenyatta, asked me to be his presidential advisor. And most recently, our current president, President Ruto, asked me to work on something important called the Shakahola Massacre. What point am I making? I am making the point to all of us that as an elder, as one who intends to influence policy in the African context, you must establish the possibility of working across different regimes. The next thing that you must be cognizant of is what is the beast that you are working with? In other words, are you working with a government that is worried about its electability into the next term? Or are you working with a government that is confident that in its last term, it can look more closely at issues of policy? You must also be cognizant of who it is that you are working with. There are some policy holders who are strong, individual, strong man, and there are others who work as teams. And as part of your decision as to how you are going to engage policyholders at high level, you must be deliberate about finding out what kind of team player your interlocutor is. Other issues that would seem unimportant to you because you are all very highly educated is that the level of education of the person you are engaging might become important because some policymakers, some leaders feel as though you are looking down at them, as they feel as though they are imposters. The next bullet point, the country involved. Countries are like human beings. Each country has its own ethos and its own phase of development. And what will work in Kenya may not work in the Sudan, might not work in Nigeria, might not work in Algeria, and so on. And similarly, every country has its own competing social and political priorities. So that if you are, for example, going to be advocating for health in a country that is in the middle of a political struggle or a drought, then the likelihood of your success is that much reduced. And finally, the last bullet point, you must make your own assessment as to the character of the official that you are working with. Now, because we are all scientists, we go into the marketplace with what I call innocence of what a government is. We innocently believe that governments are always out to do good for the people. When you've been around for as long as have been and have seen many different regimes, you will be surprised that that is not necessarily the case. Some governments are there to ensure their own sustainability. The next one is that you must be careful because not all government and policy makers have a vision of the long term. Many are interested in 5 or 4 year or 6 year cycles when they are in power. What happens in the next cycle of power is really nothing to do with the individual who is sitting right there in front of you. We've been asked to talk about improving better healthcare outcomes. Well, you know, different policy holders have different priorities that are brought them to the table, and you cannot assume that everybody around the table has healthcare, and particularly the outcomes, in mind. Very sadly, in many instances, a lot of people have as a number one priority staying, first of all, retaining, and then retaining power. And you innocently think that we are all in government so that you can do good for a group of people called the masses. And let me assure you, doing good for masses is not always a good thing when it comes to winning elections. Before you engage what is called the typical African policymaker, you must have some idea yourself as a scientist, who is this person that I am talking to? Well, you know, a lot of people in Africa get into positions of policy because sometimes of, sadly, of tribal association, sometimes because they contributed heavily to the political campaign of the party in power. Very sadly, and I have come across these ones many times, there are people who are called policymakers who are functionally illiterate, meaning that you give them a written brief, they look at the pictures, and then they make a decision from the pictures that you have given them. This is true. Yet others have no concept of what the fact of policy means. They go into those positions to satisfy their day-to-day bread. Having said all those negatives about the typical African policyholder and politician, I have come across exceptionally brilliant and loyal servants of the people, driven only by patriotism. So this is not a blanket that I am giving you. I am trying to paint a picture that is perhaps extreme, but a lot of the people that you will find in those positions do satisfy what I have said. But look out for the brilliant, loyal, patriotic individual in policy. I have a few secrets that I'd like to share with you that have made us relatively successful in engaging policyholders. The first one is that when you are together with a politician or policyholder, for goodness sake, do not compete with them. Do not appear like you want power. Do not appear like you are more educated or you have more money. He is a policyholder. You are in his office. Do not compete with him. Policy makers are human beings, and they need you to acknowledge their position in society. How they got there is none of your business. The fact is that they're the ones who are in charge of policy on a particular day. Do not take too much time describing their weaknesses. They got there because they have some strength, and acknowledge that they do indeed have some strength. The worst thing you can do for yourself is to appear to be looking down to a policymaker because you have PhD in this, PhD in the other one, and you know what in Kenya we call kizungu mingi, a lot of complicated technical jargon. That is sure to get your very, very good policy thrown out of the window. Even as you put your health care priority to them, remember to point out that you know that he in government has many competing priorities, including security, education. And remember, and this will come as a surprise to some of us, health is not one of the explicit mandates in government in general. Security, international affairs, administration, they have other things that are more important than you would like to believe. Mind your language. Now, this sounds like a television show, but actually, language is everything. When you engage policyholders and politicians, speak to them in a language that they understand. Reduce your conversation to bites that they will understand. Like we can increase the tax base. Predictive modeling can help us to find places where we can have water for their poor people to avoid diarrheas. The practical benefits of big data include understanding the numbers of people in your family, Mr. Whatever your name is. Talk to them about drug abuse and the way that drives crime. In other words, speak to the policyholder, not in technical jargon about value, volume, velocity, variety, veracity, and so on, but actually talk to them in a language that makes sense to them. And for goodness sake, and this is a lesson I have learned over many, many, many years, if you have to do a written brief, make it very, very brief indeed. I've already made this point. Provide relatable examples. Talk about GDP, they like that. Talk about vote, they like even better. If you're going to talk about challenges of health, mental health, and due to climate change, talk about malaria. They all know about malaria, pastoralist, and so on. Whatever else you do, whether you like the policy and government officials or not, they are your allies. And you must allow them to behave as though they are your allies. Acknowledge their centrality in moving things forward. Empathize when they tell you that they have very difficult bosses. You can tell them you also have difficult bosses. Recognize their small and sometimes very large efforts at understanding complex things like big data. And you know, there is nothing you can do about civil servants being late to meetings. That's how they work. That's the way they work. There's nothing you can do about that. And very sadly, some of them spend more time describing why things cannot work than trying to find solutions. And finally, don't think that the big man in a big or big woman in a big office is the only one who works in government. The security guard at the gate could delay you for an important meeting. So do not ignore. And I say this with great seriousness from my experience of the seemingly smallest of the small people. I'm coming to the end of this presentation. This is a very, very important message for you. Remain focused on your message. The way to kill your message in front of a policymaker is to start making personal requests about this, that, or the other. You are in that office for a scientific purpose, for the public good, not to try and get your cousin or your aunt a job in government. You will kill your message by making a personal request. Allow them to understand that even scientists are human beings like you are, and like the policymaker, your wish is to serve the people. Remain focused on that message. When you say big data, you will scare some people not familiar with big data. So allow them to understand it as statistics or mathematics, which will, of course, all of us learn in school. But what we have here today is slightly more complex. Some will tell you that big data will go against the law because data protection laws. Assure them about all the complex things that we do to ensure that data protection laws are respected at all times. Now, what am I asking you to take home as we conclude? Believe me, there is no way you are going to influence politicians and or policymakers as a sprint. You will do it on small steps over a marathon, full stop. Great speed never worked. Secondly, don't allow anybody to persuade you that what worked in Tanzania is likely to work in the Congo. It is not true. Every country has its own peculiarities, and you, as one trying to influence policy, must understand your own jurisdiction. Every policymaker, surprise, surprise, is an individual Each of them has their own fears and strengths, and spend time understanding your policymaker and people in government. It pays dividend to understand them as human beings. Take time to know your interlocutors. As I've said before, some of these men and women are very, 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 very good in what they do. And one of the things that I have advocated is that your skill is to actually look out for and find those policymakers and government officials who have great people. And those are the ones that you must work with selectively. Remember that you're asking the policyholder to make your case, sometimes to people above them, people horizontal to them. Facts and ideas, engaging in private and in public is the way forward. The next bullet point is important. Your message must be consistent and truthful. If you are ever found to have miscommunicated or exaggerated your message, you are digging your very, very early grave. And whatever else you do, you must make sure that the stakeholder, the person for whom you are speaking, is at the center of the communication. Perhaps I was asked to come and speak in this forum today because following very many decades of advocacy in Kenya, mental health came to top of the priorities in June 2019. Our government puts together a mental health task force, which examined mental health in the entire country. I was subsequently appointed a presidential advisor, a role that I would advise any government in Africa to try and hold, because it helped us get into place with a policy. We have an action plan. We embedded the Mental Health Act. And now, as is evident by some of the people attending this webinar today, we have a core team of multidisciplinary players who are advocating our agenda. So, ladies and gentlemen, I am convinced that if you follow these take-home messages, no jargon, we'll be able to make progress, even as data scientists in this, our continent. I thank you all very much.
Thank you, Dr. Jenga. We will take questions after the second speaker. Really wise words from and lessons from Dr. Jenga. I believe that we should learn to become politically, emotionally intelligent, learn to read the room, understand our interlocutors, as you said, whether they are strong men or women, or whether they are team players. So that's really great. But we'll have more time after this to receive questions from the audience. So I will now introduce our second speaker, Dr. Kakusa, and he will take us through the next presentation. So he is currently the Health Informatics Manager at Sir Kimitui Masiri Teaching Hospital. He's previously served as a senior lecturer in computer science and coordinator for the e-health research unit at the University of Botswana. He's also the founding chairman of the Digital Health Technical Working Group under the Ministry of Health in Botswana. Academic and professional background is in computer science, health informatics, social informatics, and specialization in telemedicine. I'm going to jump to a few of the key projects that Dr. Ndlovu has been involved in. There's the project manager in 2014 for the implementation and scale-up of the first mobile telemedicine solution under the Botswana Ministry. And he is currently also the principal investigator and an implementation partner for mobile clinic decision support system, Visual DX implementation in Botswana. He's also part of the team that worked on a PEPFAR-funded grant for informatics and telemedicine in Botswana, where together with his team, they built a sustainable. So he also participated in curriculum development of an introductory health informatics course at UB, and reviewed, I think quite importantly, the Botswana National eHealth Strategy. So Dr. Ndlovu's research focus is on developing an evidence-based interoperability framework for linking mHealth solutions with other e-record systems for Botswana and similar development. So we surely from his experience and hand over the floor to Dr. Ndlovu. Thank you so much.
Thank you so much, Michelle, and good day, everyone. And it's such a privilege to speak after such wisdom by Dr. Njenga. I think there's a lot there that, your message or your presentation had, for us. I think I also learned so many things there. So as already introduced, I'll be also speaking on how to engage policymakers. But my specific focus would be targeted towards the research work that I've been doing while at the University of Botswana, coordinating a unit, the eHealth Research Unit, where we collaborated very closely with the Ministry of Health. So I think we all know the webinar objectives. So this slide here just shows the, the unit, the eHealth Research Unit, which I coordinated at the University of Botswana. So established in 2016, this unit brings together 3 faculties within the university, Faculty of Medicine, Faculty of Health Sciences, and Computer Science, working very closely with the government through the Ministry of Health and other key stakeholders to drive digital health agenda, or rather support the agenda for digital health from a research, development, and capacity building perspectives. So the mandate of the UB eHealth Research Unit basically is to foster electronic health research and capacity building around health informatics within the University of Botswana and also beyond the university. So the unit seeks to establish a link between the health sector and provision of relevant ICT solutions. We actually do so by bringing together projects, people, and everything that is towards upscaling or fostering digital health research. Especially our research focuses on low cost but high impact type of technologies, utilizing mobile health technologies which are relevant for low resource settings. So we have a very strong relationship with the Ministry of Health here in Botswana and other key stakeholders, and this actually gives us a wider appreciation of the local e-health landscape. So we have, when we started, got into an agreement with the Ministry of Health so that we can formalize how we work together and make sure that whatever that we do in terms of research aligns with their priorities, so that it is not just theoretical findings, but translates to something that ministry can benefit from. So back in 2012, there was this common gatherings that the government of the day was actually advocating and conducting, and they were calling them in Setswana, they were calling them Pitso. So Pitso is just a Setswana name for calling. So they would have ICT Pitso, they would have agricultural Pitso. So we sort of aligned with the notion or of Pitsos. So we came up with the health informatics Pitso, so that the government of the day could actually resonate and see that we are supporting their direction in which they would want to build capacity in the country. So by then, in 2012, health informatics was fairly new. There was, very little in terms of knowledge. So the 2012 Pitso was, to sensitize policymakers on the then new field of health informatics. And then in 2013, we followed up with another one, still called, it was the second health informatics Pitso. And this one dug deeper into topics such as education, mHealth, and the formation of, the Health Informatics Association of Botswana. So things went quite a little bit beyond 2014. All this were, donor funded, the 2012 and 2013. And there was a lot of participation. As you can see in this slide here, we had a lot of, participation from government. So we made sure that they were at the forefront, owning up, to the health informatics Pitsos and articulating their aspirations, to digitize the health sector. In terms of attendance, this slide here just shows that a lot were from government through the Institute of Health Sciences. So a lot of them were sent by government, so that they get upskilled in terms of how they could leverage on health informatics technologies and tools. 2013 also, we saw a good representation because you're still speaking the same language. PITSOS, health informatics pitch, which the government of the day was, fond of. And we got good attendance, across different, ministries, sectors of government. So this slide here just shows the numbers in 2012 and 2013 went high to more than 250. And then we had some outcomes, from the two, one being the, health informatics community being sensitized, educated in health informatics, and also having benchmarked regionally because we had speakers who came from outside Botswana. We had some Fogarty grant support through University of KwaZulu-Natal, where 5 Botswana students were trained on postgrad programs on health informatics, and 3, including myself, benefited on the PhD in telehealth program. We had also curriculum task force for formation and also establishment of the Health Informatics Association task force. And then the local health IT and mHealth networking sessions also. So this slide here just shows how we involved different government, officers so that they actively participate in the formation of the Health Informatics Association of Botswana, and this was also supported, by international partners from University of Pennsylvania. So the objectives of the Health Informatics Association was to promote and practice of health informatics in Botswana, and also to ensure that we promote the health informatics profession, and also look for any opportunities for development, promote strategic partnerships locally, regionally, and also internationally. One of the things that also the health informatics piece also came as a benefit, especially to government, was support to establish a health informatics unit at the Ministry of Health. So we, there was a lot of knowledge exchange. There was a lot of, contributions from other countries, regional and also international, on how they establish such units. So we saw post the 2013 health informatics piece of formation of that health informatics unit at the Ministry of Health, which government really appreciated. And, all this were, multi-stakeholder collaboration, but coordinated under the University of Botswana eHealth Research Unit. 2019, we also went ahead a step, up, in terms of sharing what we have been doing over the years under the eHealth Research Unit. So a lot of work had been done at this stage, and this includes a lot of research. So the focus was more on sharing research evidence with policymakers. So hence the theme for the conference was from evidence to practice, implementation of data health interventions in Africa for achievement of universal health coverage. So we are speaking their language of achieving universal health coverage as part of the Sustainable Development Goals, number 3. So this conference was, co-funded by government through the Ministry of Health and Ministry of Communications, and of course other private partners as well. There were research findings that were shared, and we had a book of proceedings that we also shared with government so that they can appreciate what has been happening locally in Botswana, regionally, and also internationally, because the conference was an international, conference. We have been also very close to government, speaking their language. 2020, they launched the National eHealth Strategy, but prior to that, we were actually actively involved in the review of that strategy, and also in its implementation, which is coming, to the end by April this year. So government really appreciated the university's contribution. We had research projects that were aligned to the pillars, the 7 pillars that are the foundation of the strategy, the ones on the far right here, leadership, governance, strategy, service and applications, and many others. So they could see really value in, us aiding or contributing to implementation of the strategy, hence that strengthened or continued to strengthen our relationship. So we had quite a number of projects that we implemented on a public-private partnership. So we made sure that as an academic institution, we collaborate with the public sector and the private sector so that we have this project implemented here locally as proof of concept, and where possible, hand over them to government to actually sustain and run them, beyond proof of concept phase. So we had this first mobile telemedicine program that we called Konafalo. It's a Setswana name for It's Possible. This was geared towards improving access to specialty care. It cut across 4 medical, specialty areas. That's oral medicine, cervical cancer, dermatology, and radiology. It was a store and forward type of telemedicine. A clinician would take an image, maybe a lesion of the skin, store it within the phone, attach a form, and then send it. The specialist would receive a notification, act on that case. Where second opinion is required, they would connect with another specialist, outside the country, and then feedback would be sent back to the clinician. And this came with some benefits. For patients, reduction in hospital stay, saving of money, because when they travel, they incur some costs, improvement in treatment outcomes also. They were attended to before their conditions worsened. In terms of clinicians, there were a lot of skills transfer, knowledge transfer between those in the remote areas and those that are in the capital city where our referral facilities are. For the ministry, there were savings in terms of reduced number of referrals, patient hospital stay, also reduction in congestion in referral facilities. And then there was a business cost-benefit analysis that was conducted also. That also demonstrated some savings, for the government and also for the patients. And then in terms of clinical outcomes across the 4 specialty areas, so these are the numbers in terms of patients that were seen across different specialty areas and clinicians that were trained, and number of cases, more than 600 cases that were treated remotely. And this motivated us to come up with a paper titled Scaling Up a Mobile Telemedicine Solution in Botswana, and we're talking about keys to sustainability of such solutions. And having appreciated the full benefits of the study, proof of concept, government took this project further, and they collaborated with a private company, in this case, telco, Orange Botswana. They signed an MOU, Memorandum of Understanding, to take up the project at national level beyond the limited proof of concept. So this was a result of the value realization by government post the research and also the pilot that we conducted. Another successful project was the portable eye examination kit, which also started as a proof of concept. So this was a technology that would screen for visual acuity, targeted kids at school, primary all the way up to senior. We had a proof of concept across 49 schools. More than 12,000 kids were screened. There were so 24 schools that were involved, and over 2,000 kids were triaged. SMSs were sent to parents, both in native language and also in English, just to let them know about the eye care or eye health, for their kids. And there were some benefits also to the kids, and that not only did we screen, but also we completed the treatment. Some got medications, some received spectacles, some were referred for further observation by optometrists. We published also a paper on implementing a school vision screening program in Botswana using smartphone technology, which also was shared with government and also the entire academic body. So having realized the full benefits, the government took this program up. In this picture here, top left corner, there is our current president with one of the peak vision, CEOs, and the one on the right there is the then Minister of, I think she was the Minister of International Relations. So being demonstrated the platform, they had prior, appreciated the benefits that came with the pilot. And then they committed that Botswana will be the first to roll out, screen every kid. And this project is currently ongoing, being rolled out across the entire country. So this, like the previous one, was a result of the policymakers, actually saw value following, work that we did, collaborating with them, speaking their language, addressing the core issues that actually matter the most, to the current of the day. We had the television white space as a telemedicine project. We collaborated with different stakeholders. This was a live telemedicine. It was not a store and forward like the previous one. So we could, clinicians could talk to specialists in the capital city to assess a complex, cervical cancer case. And then, of course, it was also an educational platform, for those that are in the remote areas. This year, just a slide during the training sessions that we conducted with various, clinicians across different facilities. We published also an article on that, just so that we could spread the message, not only within the country, but also within the region, so that others could also learn from what we did here. We did the same for TB contact tracing. We used an open source platform, USSD technology, so low cost, high impact technology, which is what the government of the day emphasizes. So we went into such so that we get buy-in and support, and also that the government could see it sustainable if they could take this and run with it. We also had publications. So for each project, we'd publish the results so that this becomes, public knowledge, that informs even policy decisions. This one is the most recent one. Is still work in progress. Visual DX, mobile clinical decision support system in Botswana. So you take a picture of maybe a lesion of the skin, and then there's some AI algorithms that would compare that image with millions of other images that were used to train the platform, and then it will give you some 3 possible, diagnosis and also treatment, pathways. We have published the first, article on this, where we evaluated feasibility and acceptance of the platform in Botswana, given that, we are a low resource setting. Some of the challenges in closing that we've been encountering over the years was high staff turnover rates, especially senior government officials. You try to align with their language, or you convince one that this technology could help us improve, our health outcomes. Once they grasp it, before you know it, they're already out of office. We've had also even those that are below that were trained, and they were actually leads, in advocating for the programs, leaving the public sector, now joining the private sector. Sustainability has always been an issue, mainly because most of the time there is no dedicated funding to support, a life cycle or the life cycle of a project beyond pilot phase. Just recently, government has been prioritizing digitalization, so I guess this maybe not be a problem anymore. And then lack of robust regulation of e-health services has been some sort of a deterrent to some adopting the technology. Very limited expertise. There are very few people with expertise here to develop e-health solutions and services, and also upskill others. So bringing the question of readiness. Socio-cultural issues, some perceived technology as an added burden, so there was a bit of resistance to actually changing from the normal routine. And then some suggestions on how to enhance visibility, work relations with government bodies. I think, as the previous speaker has already alluded to, we need to align to national priorities, speak the same language as the government of the day, and target solutions that address government problems to gain their interest. Involving government bodies from the onset versus doing it in the middle or at the end is another very, very important consideration there. And pursuing, here in Botswana, we have got research grants that are addressing specific problems. So these are funded also by government. So for countries that have got a similar arrangement, I would advise that pursues those. because by so doing, then you'd be guaranteed that once you get it, or the fund would be guaranteed that once you get it, you'll use it to address national priorities. Technology solutions go for low cost, high impact, because those could be more attractive and sustainable. Open innovations, co-creation, versus just doing it alone. Explore offering no costs opportunities for capacity development and co-authorship. Like in our case here, an academic institution would make sure that we offer, free of cost capacity development programs to government, and also co-authorship of the research, papers that we do here. And that way we build confidence and trust and, buy-in from them going forward. I think that's the end of my presentation. I'll hand over to the chair. Thank you so much.
Thank you so much, Dr. Nduvu. So we're going to go straight to questions, as we have about 15 minutes left, and we do have 5 questions in the Q&A. People have been using the Q&A chat, so thanks to the audience for sharing your questions so far. I will call on Rachel to assist us. She's the co-chair of the Partnerships and Outreach Working Group, to assist us to monitor whether people raise their hands. We'll first address the questions that we have, and then we'll also monitor for questions when folks raise their hands. So the first question is from Michelle M. So thank you to Dr. Jenga. I found your presentation very insightful. You rightly said every African country is different. So what advice will you give those working in a system where the same government has been entrenched for decades and might not be driven by the same motivations like a government worried about the next election cycle? How best can you engage them? Dr. Jenga, that was for you.
Yeah, this is a point I kind of made, that every jurisdiction has its own peculiarities, strengths, and weaknesses. I think when you are dealing with a government that has been in place 20, 30, some even longer, I think understanding, if you can, what drives that particular system is all I can advise, and to acknowledge something that I said already. Impacting on policy and on politicians is a marathon, and you can. I was actually smiling when my colleague said that the moment they seem to understand what you're telling them, it's time for them to move on to some other assignment. It's very frustrating, but I mean, you only have one Africa, you only have one country. We really have to work on that.
Thank you so much. So the next question is for both speakers, so you can both respond. So thanks for these great presentations. This is from April. I'm wondering how you know if a policymaker is more a strong man or woman or a team player, and what their priorities are. So you can speak their language, basically. How do you find out this information if it's not commonly known? So how do you know whether someone's sort of more authoritarian or team player? So to both speakers, you could respond to April, please.
All right. You want me to go first? I am happy to go first. I think, in a sense, the point that I am making is that as much time as we spend on scientific research, some of a legitimate ways of spending our time is in studying our interlocutors in private and in public, getting to mix with them where possible. In some countries, it's possible. At certain levels in society, it's possible to meet them socially, sometimes formally. But every opportunity that you have of engaging with a policyholder, formal and informal, it's the only way. I don't know that only formal contact by way of letters or emails will get us to where we need to get to. That's my view. And you study them, just like we study science, we study all those people who are so important for all the very important work that we do.
Thank you. That's brilliant. Please go ahead, Dr. Mluvu. Do you have anything to add in your experience?
Yeah, I think Doc has summed it up well. From our end, we asked ourselves, okay, so what are the policies and strategies that are currently in place? So we started first by digging for those and appreciating, fully understanding the strategic direction, and also taking it a step further. So who actually drives the strategy? In our case, it was the national e-health strategy. After understanding it, then we aligned our priorities in terms of research projects and our capacity building programs with the specific areas outlined within the strategy. So we took it a step further and went to Ministry of Health and met with those that are in charge. Actually, during the launch also we were there. Even prior to the launch, we participated in the review. We contributed that freely, just so that we can also understand and have something that would add or contribute something to the country. So I think it starts with asking yourself, okay, what policies and strategies are currently in place and what are they saying, and try to align to that and take it a step further by maybe physical meetings. Yeah, thank you so much.
That's fantastic. Aligning and making the time to engage the specific folks involved in the policies in the country. So that's great. Thank you. So another question for Dr. Ndlovu from Zakir. How many digital mammography machines are in use in Botswana, if any? We are implementing a program in Africa where we can use mammogram AI to enhance diagnostic accuracy of breast cancer screening, and also using mammogram AI to detect breast arterial calcification, so that's BSC, for coronary heart disease development and scoring and prediction. So can you respond to Zakir, please? Thank you.
Yeah, very brilliant question there. In terms of the number, I may not have the exact number, but I can follow up on this. But there are data mammography machines in Botswana. What I can confirm is the AI component of those, like mammogram. That may not have been implemented here locally. I've never heard of such from government and also from the private sector. Maybe we need to establish that and how the gap could be addressed. Possibly what we are implementing could also benefit us. So I can reach out to you if maybe through the organizers, just to give you more details after this.
Awesome, thank you. So we have another good question coming from Amit. Also says thank you to both speakers for the excellent presentations. Do you recommend researchers engage with policymakers before starting new research projects? If so, what advice can you share for an initial conversation to both speakers? Thank you.
Yeah, so if you like, so I think part of what I mentioned in my presentation is that policymakers should be engaged from the onset, from the brainstorming session before you even, embark in, a research study that would make impact nationally. Just find out, from them, from the right offices, what are the priorities, from the onset. I think there could be different ways to actually kickstart conversations, whether through maybe a workshop, organizing a workshop where you could do knowledge exchange or knowledge sharing or skills gap, analysis if it's something that has to do with capacity development, or so different ways actually. Some would do maybe if you want to dive deep into the gaps, like a SWOT analysis with key stakeholders. So I think having them from the onset really increases ownership and and also buy-in, and they would also help to direct the research so that it addresses pertinent issues that they are currently battling with. And so I think for me that has actually worked for us versus studying something and then bringing them on board after maybe having implemented, came up with even like a research objectives, and having solicited some funding also. That way, they would sit back and think, yeah, this is your project, go ahead with it, because they did not actually participate actively in the formulation of that particular research study.
I agree 100% with what has been said, except, well, not except, to which I would add the following, that policy makers are like all of us human beings. You really need to show some interest in their other lives. So if they invite you to what appears to be a very boring, uninteresting meeting that is of import to their ministry, for example, it would make sense for you to be present with them, if only to show them that, well, we are scientists, we're interested in data, but we also recognize that growing potatoes and beans is a very, very important thing. And actually, that could set the opportunity for you to then invite them to your engagement meeting on your policy. A lot of footwork and a lot of perhaps what appears like time wasting has to be made if you are to get into a long-term relationship with people who have priorities that are not necessarily the same as yours. But they are human beings, and they need to be understood and appreciated as such.
Thank you so much. So we have a difficult one now. I suppose to both as well. What do you do when policy briefs, which should help bring our research to the mind of governments, are ignored? So when policy briefs are ignored by the government, even though you bring it to them. Thank you. Dr. Nchingi, do you want to go ahead?
Okay, all right. Yeah, just because it's a difficult question, you want me to go first, not a problem. I mean, this will bore you. It'll bore you because I'll say, if it doesn't work this time, you must try again. If it doesn't work, then you must try yet again. Remember, I showed you a slide where I was saying that you must be consistent, you must be persistent, and you must be truthful with the entire message that you are giving. So I think if it doesn't work with this particular official, try the same message with a different official at another time. The one thing you cannot afford to do is to give up.
Thank you so much. We are really running out of time, so I'm going to skip to Cynthia's question. So she says, thank you for these informative presentations. An African member of a global health informatics volunteer community would like to do research on his country's health records. I suggest that he writes a brief letter to the CEO of his country health data system, but he thought it was better if a non-African expert with an established record of health informatics research wrote the letter, because such people carry more weight. What is your opinion on this? That one of those countries or two country unique situations. Sorry, did you get that? It was a bit long, but.
Yeah. So I think we got that. There was another interesting one that I thought maybe would also benefit the audience here. I don't know if you're still there. The one on donor-driven development mentality of African politicians to look at problem-driven development. I think there's an interesting question there. There is a lot of donor funding and probably issues of sustainability. If you allow me, I think I could start with that one.
Okay,
issues of
please go ahead.
Sustainability are actually hindered by this donor-driven mentality. So one maybe possible avenue to explore is a triple P model, which I alluded to earlier in my presentation, where you collaborate, you extend, you reach out to the public and the private sector, academia working together, you co-create, each contributing something, it may not be financial support, maybe in kind, but towards supporting research or a project. That way, there is local ownership. There is sustainability in that there is capacity that is local that can drive the project beyond its lifetime, because those donors are actually limited, and they come with a lot of restrictions in terms of how the solution should look like, where the data should sit, and even the lifespan of the project or the solution rather that is used to address a particular problem. So yeah, to me, I think a public-private partnership model could actually, sort of alleviate such a, a situation. And then I think the question by Cynthia is also a bit tricky. And I trust that, Doc, maybe he could do justice to it. To me, I really don't, understand why someone who is non-African, and both of them, an African and non-African, they're experts, why really one could not be considered over the other. So it's a bit tricky, because to me, really, it is not an issue of where you come from, is what you demonstrate could actually work. In your application, the value add to whatever proposal that you're pitching forward. If it makes sense, really should not be just against whether you're African or non-African.
Well, I mean, if you want me to weigh in on this one, that is a point I made hesitantly earlier on, when I said that you really must know who your interlocutor is. If your interlocutor is one who believes that science from Nigerians is superior to science arising from South Africa or India, whatever it is, that is the person you have to work with. That is material that is in your hand. And your skill as a scientist includes understanding the prejudices that this particular policymaker has. I mean, he's the only one you've got. You can't dismiss him, because if you dismiss him, then who are you going to deal with? Unless you wait for the following guy to come along, hoping and praying that. So these are precisely the difficulties that I am alluding to. That all these are individual human beings who have very difficult and very peculiar preferences and opinions, some of which will disgust you. But he's the only one who's there right in front of you.
So thank you both for those answers. We have come to the end of our webinar time. I really do want to thank our esteemed speakers, Dr. Njenga and Dr. Ndlovu, for taking the time to share their experience and knowledge with the DSI Africa Consortium and our guests from the broader public. And I also want to thank our moderator and our facilitator, Francis Agama, and also our members of our partnerships and outreach group, the chairs, Aliki and Rachel. So thank you so much for joining us, and we will try to share the various URL links and slides with you if possible. And we hope to see you at the next webinar. Thank you so much. Oh, so Aliki will also do a vote of thanks. Thank you so much.
Thank you, Michelle. Thank you.
Thank you so much. Just I'm Aliki Edgecombe, for those of you who don't know. I chair the Partnership and Outreach Working Group. And I just want to really thank Dr. Njenga and Dr. Ndlovu for the wealth of experience they've brought to the table today, and not just giving us a lecture, but actually sharing with us strategies for communicating better with policymakers. Your firsthand experiences offered us invaluable insight and perspectives, and actually allowed us now, as we leave, to really be thinking about these things more deeply, to be advancing these dialogues within our own context, and to really be thinking how we can engage policymakers in the context in which we live and operate. Thank you for bringing to light the soft skills that are actually needed for this. And we appreciate your time. And we also appreciate for showing us what is possible when we continue to persevere and have these conversations with policymakers. Thank you for reminding us that it is a marathon, not a sprint. And we hope now that we can go forth and actually build these relationships so that our science doesn't stay in books, but actually informs policy. So thank you very much to both of you for your exceptional service to us this afternoon, your time and your effort, and sharing your expertise and experience with us. Thank you.
Thank you, Aliki. Thank you so much for the opportunity.